Hi, Dr. Bela speaking. In this video, I'm gonna answer a couple of questions about a new filler called Harmonyca in Allergan's Juvederm range. So Harmonyca is a new add-on to Allergan's Juvederm range, and this is a dual action hybrid filler, which means it has two different components, and as the name suggests, this is HA at the beginning of the name, which is hyaluronic acid, and Ca, which is calcium hydroxyapatite, responsible for a long-term collagen production, which improves the architecture of the skin. So this is, as I said, a dual action filler. So one of the components is HA, which gives an immediate refreshed look, a lifting effect to the side of the face. And there is the calcium hydroxyapatite component, which triggers a long-term collagen production, which on the long term, beyond the longevity of the HA component, improves the architecture of the skin. And these benefits are confirmed in a clinical study. So Harmonyca is mainly for the treatment of the lateral, the side of the face in front of the ear, and not at the mid part of the face or lips especially. So this filler is for those who are kind of looking for a lift from an HA filler, but when I analyze the face and I make a decision whether Harmonyca is a good fit for you or not, I'm looking for dynamic lines in front of the ear, the side of the face, which show up mainly when you smile. So if I smile, I don't really have these fine lines here on the side of my face, so Harmonyca wouldn't be the first priority in my case. But someone smiling and these tiny lines showing up on the side of the face, you would be a perfect candidate for Harmonyca treatment. And when you have the initial consultation on one of the treatments and I analyze your face and I give you a personalized treatment plan, I come up with the recommendation of Harmonyca. So this is not a filler that kind of patients are asking for. It's not a standalone treatment like Profhilo, for example. Profhilo is something can be asked for, but Harmonyca is something I come up with. What is the difference between Harmonyca and the other fillers like the Juvederm volumizing fillers or the Profhilo filler? So the difference between Harmonyca and the deep volumizing fillers is, as the name shows, or says, Voluma, the other products in the Juvederm range, are for deep volumization of the face. So the filler goes on top of the bone or the deep fat layers, and by doing so we improve the projection of certain features of the face, so we revolumize the face from the depth. So it's a more fundamental kind of treatment, while Profhilo and Harmonyca is a treatment of the surface of the skin. So what's the difference between Harmonyca and Profhilo? Profhilo gives more hydration into the skin, injecting in these aesthetic points, and it spreads in the skin and hydrates the skin, while Harmonyca is, as I said, it has a HA, so a hyaluronic acid component in it, but mainly the big difference is the calcium hydroxyapatite, which on long term induces collagen synthesis. So it's not only hydrates the skin but improves the structure of the skin. It's more a structural improvement compared with Profhilo. And since this is Harmonyca is a superficial treatment, we don't have the risks of the deep volumizing fillers, such as vascular complications. This is a very safe treatment. What can you expect from the treatment? So when I recommend you the Harmonyca filler treatment, you can book in for a 45-minute appointment. As usually, I examine the face, I come up with a treatment plan, I explain you everything, cleanse the skin before photos, and mark up the treatment. Usually the treatment involves 1 to 3 injection sites in each side of the face, and this is the entry point for the cannula. So this filler is cannula only, so it cannot be done by a needle. in spite of there is a needle. It comes with a needle, but it cannot be done with a needle, only by cannula. So there are one to three injection sites on the face, and it's a very, very superficial treatment. There is no big discomfort involved in the treatment. It's superficial, and altogether 2 syringes are injected, one each side of the face, and one syringe is 1.25 milliliter. After the procedure, it's very important. There is no exercise on the day, no sauna, don't touch the injection sites, and don't put any makeup on them. Minimum 12 hours after the procedure. We don't want any infection, any bacteria going through the needle pricks. What are the possible complications or side effects of the Harmonyca filler treatment? Since this is a superficial treatment, there are not too many. So as I said, we don't run the risk of the deep volumizing filler, so we can't have any vascular complication. Maximum the bruise kind of that can happen at any time when a needle pricks the skin. Little bit of redness, a little bit of swelling, maybe a little bit of discomfort, but that nothing major, and everything goes within a couple of hours after the procedure. The next question is whether you can combine Harmonyca with Botox or other fillers or Profilo. As I talked about it, yes, it can be combined with anything. It can be combined with Botox at the same appointment, because Botox is mainly for the upper third of the face, and Harmonyca is for the side of the face. That there's no problem doing the 2 treatments in one appointment. And when I do fillers and Botox at the same appointment, I always start with fillers and finishing with Botox. It also can be combined with Profilo and with other volumizing fillers from the Juvederm range, but not during the same appointment. So I would recommend to wait 6 weeks minimum between other filler treatment, but other than that, you can combine, you can treat the same area with all these fillers. And finally, I have some warnings regarding Harmonyca filler, which means 2 things that I would like to emphasize. One, that I said earlier, it comes with a needle, but this is not a treatment with a needle. It should be done by a cannula. So if your practitioner, if you are not my patient, and if your practitioner want to do it with a needle, that's absolutely not good. And as I said, this filler is just for the side of the face. None of the features in the middle of the face can be treated with Harmonyca. The technique of the Harmonyca treatment is relatively unique, so it should be taught from an experienced trainer, and I'm injecting for over 10 years. But when I had my training with Allergan, it was an experience to really feel the layer where we need to put the Harmonyca in, and it doesn't come by itself. It needs to be experienced. And also I experienced why the 6 weeks should be kept between 2 filler treatments of the same area. So when you are not my patient watching this video, make sure 2 things. One, it's delivered by a 22 gauge cannula and not a needle, and your practitioner had a one-to-one training with an experienced trainer about the technique, how the Harmonyca should be placed, because if it is placed deeper than recommended, then you have other risks coming in because of the deeper placement. And secondly, and maybe most importantly, you lose the benefits of the calcium hydroxyapatite, because if it's not placed in the dermis, in the deep dermis, it won't trigger any collagen synthesis for the long run, so you just lose the value of this filler. So I hope it helped you. If you need any further information, please visit my website, which is drbela.clinic. And you can make appointments if you wish on all the details listed on the website. Thank you for watching, and see you soon. Bye for now.